today's the day I'm going to take Christy up on that offer. Take a couple hours for myself, hang out with Pearl Girl, see what she's been up to. Hey, look at that, it's noon. Hope they got someone for the show. Good.
Yes, indeed. They did get someone for the show. That someone is me. I am Katie Regner, sitting in for Jeremy today as he takes Christy's advice and is taking a well-deserved break from our live show today. But I do have Christy joining us to give you some updates, and it's also National Nurses Day. So we'll be spotlighting the many ways that the V team continues to support those healthcare workers on the front lines. But to start off our broadcast today, I wanted to share with you a story about one of our own V teamers, Mike Telenko. He works on the Learning and Development team and is based out in Ohio. His wife, Brittany, is an ICU nurse on a step-down unit at a local hospital. They've got 2 young boys at home, and we caught up with them earlier this week to see what life is like in the Telenko house. Take a look.
I'm Mike Telenko. I'm a senior trainer for the Verizon's consumer group in the Cincinnati area. Go a lot of places most of the time, even though we're not anymore.
Life in our house right now is interesting. Mike has nestled in our front room here and created an office, which he tries to work in with our children in the background when I'm at work. When I'm home, we switch roles and I take over, and sometimes the kids get dressed and sometimes they don't, and making the best of it.
I know from the top all the way down, it's been very surprisingly open to the fact that things are a little weird and a little different. There's a kid that wanders in or a dog that barks. It's not the end of the world, and it's nice to have that support from all of the leadership that we have.
Years and years ago, my grandmother, when she was pregnant with my dad, she got very, very sick and was paralyzed essentially for the rest of her life. My aunt was a nurse and took care of my grandmother. So that always inspired me to pursue the healthcare field. And now I work at a hospital on an ICU step-down unit. And now with the COVID, it's become quite challenging at times. There's a big portion of healing and getting better with interaction with people and family members. Their family members can't be there to comfort them when they're not feeling well. And technology's been great. Video chat's been awesome to try to keep these patients calm so that you're not the only eyes that the patient sees. I have made calls to family members with my phone and let them, speak with their loved ones. I try to video chat with my family while I'm at work and try to stay connected that way so that we don't lose that.
A lot of people know that my wife's a nurse, and they've told me to tell her thank you and that sort of thing, and she's been a superhero around here.
I'm very thankful that Mike and I are both working and we're still able to get by, and we have the opportunity for him to stay at home and take care of our kids when I work. This will get better, and everybody's feeling it in one way or another, so just try to stay positive and keep moving along.
Thanks so much to Mike and to Brittany and the family for sharing their story. And Brittany, thank you so much for everything you're doing for your local community. And with that, I'll turn it over to you, Christy, for some updates. Good afternoon.
Thanks so much, Katie. Great to have you with us here today, hosting Up to Speed. And I'm so glad that Jeremy took our advice and is taking a day off, and great to see him there with Pearl in the hammock. And I just want to remind everybody, like I talked about on Monday, we are really encouraging everybody to think about where you are, what plans you had for time off, and start to make new plans for vacations. I had 2 family plans and trips canceled by the organizer or by the travel restrictions of the country here. And my husband and my kids and I are thinking about what we want to do in this new normal to get our time away and get our downtime. So I know it's so important for all of us to take care of ourselves physically and mentally. And so that's why we have vacation, and we want to make sure folks are making those plans. So good to see Jeremy doing that. And speaking of taking care of ourselves, what a great way to bring that to light today as well, given that it is National Nurses Appreciation Day. And it was great to see in that video, the Telenko family. Thank you so much, sharing your story with us, and also being out there on the front line as a nurse. And for our employee who's one of our trainers, which is great to see, figuring out how to adjust to a new way of working, balancing family and responsibilities like so many of our V-teamers are. Nurses really are heroes in this crisis. They're really right out there on the front line with emergency workers. And Verizon is so supportive of our first responders and our frontline folks. And so we really want to just continue to highlight. Thank you, Brittany and others, and we'll have more highlights on that today. For nurses, for me, it's also personal. My mom was a nurse. One of my sisters is a nurse. And I think, the times I've been in the hospital, whether it was having children or for other personal reasons, the nursing staff were really the key interface and element of my stay and my engagement with the medical system. So I know they're a key partner to the medical teams that they're on, and so important in this crisis. So thank you to all the nurses that are out there. And so a couple other things I thought I would share and just general updates. Last week, Joe Russo and I talked about how we're preparing for continuing to help Verizon thrive as we live with COVID. And we're doing that by making sure we keep our employees' safety and health at the front of our mind, and at the same time, step up to our social needs to keep society connected. And we heard even in that video how patients who can no longer have loved ones visit are relying on video chats and other telecommunication means to stay connected while they're in whether it's nursing homes or whether they're in hospitals or other places where they're getting care. So we're really working hard to keep doing those two key things. We've got a lot of work underway. We heard from a lot of employees that they're wondering when they're going to hear more and how they'll know how this is affecting them as we move toward June 1st. And so we're hard at work so that by the middle of May, we could talk to employee groups and employees individually on where we believe we could scale parts of the business to return to the office, or where we think we'll have extended work from home. And we also want to continue to give a shout out to our field staff who have remained working outside the home, and also to our retail teams that are in for our footprint that we have open to provide essential services to the public and to our customers. So we're working to support all of our employees and figure out how we continue to evolve. We will give lots of advance notice, and we're factoring in all of the concerns that people have around society being open, school systems being there to support them or not, et cetera. We're working actively with our team in China right now, where China is reopening society. And there's other countries who have hit a different point in the COVID response that are beginning to do that. And we're working with those teams there. And we'll have more to share and more learnings from that. And then finally, before I have Katie throw me some questions, I also wanted to share that yesterday I hosted a meeting with 200 HR leaders around the world virtually in a conference all day. And it was originally planned to be a midpoint check-in on our plans for 2020, things we needed to deliver for the business, and our transformation to support Verizon 2.0. And as the meeting was drawing closer and it was very obvious we weren't going to meet in person, rather than cancel the meeting, we converted it to a virtual forum. And I want to say it was actually pretty awesome. On a scale of 1 to 10, being in person might have been a 10, canceling the meeting would have been a 0. And I feel like we netted out somewhere between a 7 and an 8. We got to see and hear from so many colleagues on the team, have the virtual chat going, have some sub-teams share their work, lots of follow-ups from the meeting. And really just, I would encourage all of you out there that have been finding new ways to connect with your teams in any of the variety of jobs that we have. These virtual sessions can be so powerful to keep people connected and also let them hear about all the things other people on their teams are doing. And we even ended the day by letting people invite their family members, their roommates, their pets, bringing them into the room and sharing with each other a little bit of the human side of their personal story for how they're living with and navigating this interesting time. So thanks, Katie, for the opening, and let me know where we want to go from here, questions, et cetera.
All right, sounds good. And to that point, Christy, about seeing what's going on around you, if you hear some noise in the background, that is likely my toddler who is now upstairs running back and forth down the hallway. But we do have a couple of questions for you, Christy. So this one came from Amy in the VBG group, and she says, I'm contributing $1,000 this year to a healthcare spending account, but I don't think that I'll be able to use the services I had intended to use it for, given the situation and the pandemic. Is there an opportunity to extend the time that the funds can be used in a healthcare spending account?
Great question. Thank you for asking it. We get this question a lot from our employees. A couple of things to note. The savings account programs, both the health and the dependent care saving account programs, are governed by the IRS. which we therefore don't have the degrees of freedom to change. But I do want to point out, for contributions made in 2020 for employees that are with us through December 31st, you can actually continue to apply for those benefits up to March 15th of the following year. So there will be that window does go into that March timeframe, but we don't have the degrees of freedom to change that period. Thanks for that question.
And thanks, Christy, for that answer. So next, in the spirit of National Nurses Day, we wanted to ask, we have programs in place where employees can connect with a nurse if they have concerns or questions about their health. Can you tell us a little bit about those programs that Verizon has in place for the V team?
Thanks for that. So we, throughout our medical and benefit plans here in the United States, partner with Anthem. And so we have a 24/7 nurses line. And this is telephonic access. And you've heard a lot about telemedicine now with the crisis, but we actually had these offerings in advance of the crisis. I think the crisis has gotten people more comfortable with having virtual medical visits and consultations. And the 24/7 nurse line is a really awesome service. You can answer health-related questions, assist with symptom triage, or just get general guidance on how you should think about taking care of things that you may be concerned about with your health and wellness or that of your family members. During COVID, we turned to them and said, how can you help us with our employees that have contracted COVID or their family members? And so we worked with them to pivot and use the nurses hotline. So the nursing team at Anthem is proactively reaching out to our V teamers that have questions about COVID or have had tested positive to answer any questions and make sure that they know how to navigate the healthcare system at this time. We've even had employees call asking, where can I get a test if I want to get a test, or I'm concerned about my access to treatment. And so we've seen that be very positive. And then we've been working with our HR teams outside the United States to make sure that we're able to help our employees outside the United States when they need access points to medical support as well, given the move to distant and sort of telemedicine mechanisms.
Great. Thanks so much, Christy. That's all we've got for questions for today. But I know you've got a new profile on an employee that we want to share with the V team. So I'll turn it back to you to tee that up.
Wonderful. So we want to just share with you guys today another video that we have, which is pretty awesome. So we've got a V teamer, Christine Rudkin, whose daughter is a PA, now on the front lines fighting COVID-19. So from one mom to another, I just want to thank Christine and her daughter for going above and beyond what the world needs and all the good that we can offer. And it's a really inspirational sharing for the rest of the V teamers. And I think especially heading into the weekend, we've got Mother's Day on Sunday. And so we want to wish Christine a very happy Mother's Day. Let's hear their story.
Hi, I'm Christine Rudkin, and I'm a marketing manager with Verizon for 17 years. What was happening all around on Long Island was we just saw the cases go crazy, and I just felt so helpless. I have a daughter that's a PA, but because all of the optional operations have been halted, she's been assigned to COVID emergency room care. And so it really was driven for me to try to help people like my daughter on the front lines. So I was on Facebook and I saw this group, Stitch Together Long Island, and all these women from across the country were sewing these masks. And I thought, oh, how cool is that? So I got in touch with the admin. I was like, what can I do? How can I help? And they're like, we really need runners. Either pick up fabric or donations, bring them, or bring masks to first responders or to essential location. And I was all in. My leadership team, who was just so all in. They're like, when you get called, just let us know you're leaving and go do what you need to do. I just dropped off to a halfway house, and as I was walking away, a guy came out of the house and he was like, wait, thank you so much. Thank you. You don't know how much this means to us. And it just made me feel like, wow, this is making a difference to people. It feels amazing. And to date, over 40,000 masks created and delivered. What's really nice is to go out into your community and be a help.
Thanks so much, Christine, for the work you're doing and for sharing your story with the rest of us. And it's just one of the many ways that we continue to support our frontline healthcare workers. Now, you may remember a few weeks ago, we talked to you about some V-teamers who were using 3D printing to produce masks and face shields for frontline healthcare workers. Well, Sanjeev Gupta, in partnership with Verizon and the local Livingston Robotics Club, have produced over 2,300 masks for healthcare workers, and they're being used by people like these nurses at a long-term care facility in Arizona, teams at St. Barnabas and Newark Beth Israel hospitals in New Jersey, and Yvette, a nurse in Texas. And it doesn't stop there. We even have a program where we're giving food to frontline workers. And that program is another way we're supporting them and small businesses at the same time. Partnering with local restaurants and food trucks in New York City and Detroit, we've been showing our gratitude to those who are giving so much, from those working at hospitals to EMS personnel. We've distributed over 81,000 meals and supported 35 small businesses in the process. And that doesn't count the countless V-teamers who are doing things in their local communities. And we know that those who serve are always there for us, and we are there for them. You may remember that we recently announced that nurses and teachers who are keeping their students engaged, join military and first responders in getting some great offers on our Verizon Wireless Unlimited plans and our Fios Internet plans. And we also wanted to say a quick thank you, hello, and recognition to two members of our extended team. Chris, if you want to throw that PowerPoint up, there it is. So Chris Toohey, who is our studio engineer, he's actually running this broadcast from his garage right now. That's his wife, Christina, on the left. She is a nurse practitioner at St. Clare's Hospital in New Jersey. And Howie Waterman, also on the communications team. His daughter, Sami, is a nurse at St. Joseph's Regional Medical Center in New Jersey. So thank you both and your families so much for being there for your communities. And with that, Christy, I will turn it back to you for final thoughts on the day.
Wow, Katie, that slideshow and the video was so inspiring and just such a great reminder here on Nurses Appreciation Day about everything it's taking for our medical community to help in this time of crisis. So great to see the many ways that the V-teamers are connected to this or directly supporting it. And I also want to share, if you were inspired to try to figure out how might you be able to do something, go to our virtual volunteerism webpage segment and look up ways in which you can help related to the coronavirus. It could be in making masks to support some frontline nurses like you saw in the video, or other means. So really great to see this and hear about the food program as well. A couple of closing thoughts. We are obviously continuing to do everything we do every day to keep our customers connected, keep our people safe. And as we like to talk about on the Verizon leadership team here, that we're trying to respond to the crisis. And I think we're really a leader in the way we're approaching this, and we're sharing what we're doing with a lot of other companies and also learning from them. Second, we're trying to make sure we stay on track to do our business so that we are keeping the network up. We've heard from our network leaders. We've got great support and operations progress and really keeping our business as usual operational. And we're working on the future and trying to keep all three of those in front of us as this becomes very evident that we will, as a world community and as a community of employees and V-teamers, have this with us for some time. And so I think all of the collaboration and the great ideas and the innovations all of you are coming up with are helping us figure out how to do this together and do this in a way that's exceptional, that's consistent with our credo, and that allows us to be the best that we could be for each other and for our customers. So with that, I want to say thank you. And lots more to do, but we know that together we'll do it.
Christy, thanks so much for joining us for the live show today. Just for everyone else, a couple of quick reminders before we close today's broadcast. Chris, you want to go ahead and take that first slide. Select employees received a survey from the Global Technology team earlier this week asking about their IT experience. If you did receive that, be sure to get that done by May 11th. And tomorrow night, get your toes in the water, get your chicken fried ready. Another great night of Pay It Forward Live. The Zach Brown Band helping us support local small businesses. You can catch that tomorrow night at 8 p.m. on the Verizon Twitter, Facebook, and YouTube channels, Twitch, Fios 501, and Yahoo. And finally, tomorrow, we're looking forward to welcoming Nikki Palmer to Up to Speed Live. She'll be sharing some information about a company-wide hackathon her team is looking to launch and sharing with you how all V-teamers can get involved. Well, that'll wrap it up for us today. Jeremy will be back with you tomorrow. And until next time, you're up to speed.